Taft. I'm Corporate Assistant Director of Nursing at Aintree University Hospital, NHS Foundation Trust. We introduced new flexible visiting hours based on several key drivers, mainly the feedback that we got from our patients and our visitors. The key issue that we actually needed to look at and change was that there was a variation in the hospital depending upon which ward the patient was in. So there was no consistency in visiting times at all. When patients were being transferred to a different ward, say from our acute assessment areas, visitors and patients were confused. There were issues on wards as well with carers being allowed to visit during meal times to assist patients with their eating and drinking, and we wanted just to make sure that we had a standardised approach within the hospital that meant that we could get it right for every patient every time.
So the flexible visiting project particularly adds value around better patient outcomes, especially in some of the areas I work where we have a lot of patients who make certain lifestyle choices that have an adverse effect on their health. The flexible visiting project allows us to engage with their family, who are sometimes their caregivers, to look at the support that we need to offer them to enable this person to go on to live independently with support, rather than somebody having to change their destination on discharge.
I'm Gerard Barker. I'm a volunteer here in Aintree on the end-of-life companionship team. I find with the experiences when I'm going about the wards with the patients and the visitors, they like the flexible times because everyone arriving at the hospital at the same time, about 6:30 at night, it can be manic. Car parking can be exceedingly difficult, so the visitors find it easier to actually come at different times of the day. And also they've said it suits the family a lot better, because with having such a larger range of time to visit, the families can come at different times, and if they're a large family, they all get the opportunity to come and visit in the day, rather than standing outside the door and then taking 10 minutes in turns to come and sit by a bed.
So the change was led by the patient experience team. It was a real team effort, and it came about through patients telling us that they needed to have more flexibility around when their visitors could come in. So we did a lot of engagement around friends and family test, through anything that had come in through concerns and complaints, and there was some engagement as well around the general public with 1,000 FT members, Foundation Trust members, were asked about their opinions around visiting times, and all of that information formed the reasons why we led this project, and it was instigated and led by the team.
I think that the flexible visiting project specifically ties in with the leading change, adding value, commitment 5, which is about working in partnership with our patients and our relatives and our other key stakeholders to improve the care experience and health and well-being of our patients. We feel at Aintree that our flexible visiting project adds value to patients. I would say to other members of staff who have a bright idea, don't sit on it, don't be scared, no idea is silly. The team who led the change were not only the patient experience team, but also our divisional senior nurses, our medics and our allied health professionals. I can say that I'm very, very proud of them, that I think they've done a great job. They're not sitting on their laurels. We continue to evaluate what we've done. If needed, we will make changes again moving forward, but I think they've done a really good job, and I think they should be very proud of themselves and of working at Aintree.